Modern Dental Assisting, Chapter 57, Pediatric Dentistry. Pediatric dentistry is a specialized area of dentistry that is dedicated to the care of children from birth through adolescence, and also individuals with special needs. Traits to help in pediatric environment include patience, good communication skills, ability to hide frustration, the ability to keep calm in an emergency, and also enthusiasm. The pediatric dental team consists of the dentist, who has an additional 2 to 3 years of residency after dental school, and the pediatric dental assistant, further education and training specific to the pediatric setting after a dental assisting program. The office setting is a safe environment for children and adults. The reception area is typically distracting and a fun space. And the treatment area may be open bay to allow children to see others receiving treatment, but then also will have a quiet room. The pediatric patient could include children in chronological age, meaning their actual age in terms of years and months, mental age, the child's level of intellectual capacity and development, and also emotional age, the child's level of emotional maturity. Parkinson's stages of development include learning basic trust, learning autonomy, play age, school age, and adolescence. The initial examination is important for both the child and the dental team. Often the first dental experience for the child, the rapport developed during the initial examination can establish an attitude toward the dental health that will last the child's lifetime. Many dentists will follow a behavioral scale early in the treatment of pediatric patients. Frankel Scale for Pediatric Dental Patient Behavior. Guidelines for child behavior include being honest with the child, consider their point of view, use a tell, show, do, and give positive reinforcement. For the challenging patient, we may consider sedation. This is prescribed to calm the patient and put him or her at ease before treatment. Nitrous oxide oxygen. This method of mild sedation can help calm a patient for treatment. Or physical restraint. These are restraints used to prevent injury to the child and the dental team during the procedure. Patients with special needs. This includes patients with intellectual disability, Down syndrome, autism, or cerebral palsy. Diagnose and treatment planning. The first appointment should take place around the first birthday of the child. Regular examinations begin at age 2. Parental consent must be given before any dental care is provided for persons under the age of 18. The medical and dental history will include past hospitalizations and surgeries, date of the child's last visit to the physician, medications and daily medications, unfavorable reactions to any medicine or allergies, weight at birth and any problems at birth, level of learning, the main concern about the child's dental health, finger, thumb, and pacifier habits, fluoride and toothbrushing habits, and inherited family dental characteristics. The initial examination may include radiographic imaging, an extraoral examination, intraoral soft tissue examination, and examination and charting of the teeth. Oral hygiene, including efforts, are geared to improve a child's brushing and flossing technique. Fluorides. Children between the ages of 6 months and 16 should have fluoride intake daily. Fluoride varnish is being used for caries prevention on a routine basis, and a review of the diet. Sealants are applied to the pits and fissures to help keep them cavity-free. Oral facial development, including malocclusions, crowded or crooked teeth, may be identified and the dental staff may intervene. And sports safety, protective equipment should be worn during any recreational sports that might injure the mouth area. Procedures commonly seen in a pediatric setting include restorative, endodontic, and prosthodontic. Dental trauma could include fractured anterior teeth, traumatic intrusion, extrusion of lateral luxation injuries, and avulsed teeth. Child abuse may be suspected when injuries are in various stages of healing, teeth are chipped or injured, the child has scars inside the lips or the tongue, the child exhibits battering or other injuries, facial bruising, swelling of facial structures, or black eyes, the child has bite marks, injuries are not consistent with the explanation presented by the parent. Reporting child abuse, you'll need some required information, including name, address, sex, age, height, and weight of the child, name and address of the adult with custody, description of the current physical and emotional abuse or neglect, evidence of previous injuries or negligence, and any information that may assist in establishing the cause of injuries. Also, sketches or photographs documenting the nature and location of injuries.